Hello. So today I'll talk about headaches. We all have headaches. Most of us are even used to getting headaches. But remember, not all headaches are the same. I'm sure we've all seen or heard of a situation where someone gets a headache and then a few hours later the person is dead, right? So I'll talk about the seven common things to look out for a very bad headache, a headache which needs to go to the hospital. So, number one, if you have a headache and you think this is the worst headache of your life, you've never had this type of pain before in your head. So that headache has to be taken to the hospital because that might be a sign of something going on in the brain. Number two, if you get a very bad headache and you are feeling dizzy, or you faint, or someone near you faints after having a very bad headache, don't go to sleep. Okay, that headache has to be taken to the hospital because that might be a sign of something even more sinister in the brain. Number three, if you have a headache or someone near you has a headache and the person is vomiting, okay, this headache has to be taken to the hospital because this might be a sign of something going on in the brain. Number four, if you have a headache which is worse in the morning, you wake up in the morning and you have a very, very bad headache, sometimes even vomit in the morning because of the bad headache. And as the day goes by, your headache gets better. When you come back home, you lie down, your headache gets worse. You have to go to the hospital. Number five, we all have migraines. Maybe not all of us. Many of us have migraines. And we all know the pattern of the migraines that we have. We know that maybe your migraine lasts 2, 3 hours, 4 hours, and you know that your migraine usually is on this part of the body or this part of the head, and all of a sudden this particular episode of pain is not going away. It's been 2 days, it's been 3 days, it's been 8 hours, and the pain just feels different. You need to go to the hospital. Any change in the migraine pattern, you have to go to the hospital. Number six, if you have a headache and then you're also feeling weakness either on one side of the body or in the leg, or you start feeling numbness on one side of the body, or when you look at your face, or when someone looks at your face, they tell you your face looks like it's weak on one side, like your mouth is bending to one side, and you're having a headache, you have to go to the hospital because this might be a sign of a stroke. Number seven, if you've had any trauma to the head, for example, you are punched in the head, on the head, you are involved in a car accident, you fell, and then suddenly your headache gets worse. This happens usually within a few hours or sometimes even within a few days. You have to go to the hospital because a worsening headache after trauma to the head might be a sign that you are having some bleeding in the brain. Okay, so these are the seven common things that you should look out for a headache which has to go to the hospital. Of course, there are many more other things to look out for, but these are the seven common ones. All right, so remember, not all headaches are the same. Take care.